everyone, welcome back to CodeMed Mastery. In today's video, let us solve some important questions from CPT Nervous System, that is 60,000 series. We will solve these questions by using elimination method. Elimination method is an effective method which helps you solve questions very fast in the CPC exam. So let's start with the first question. Before that, don't forget to hit the like button, share this video and subscribe to my channel. This is the first question. Let us use elimination method. Before reading the question, we will check all the options. So check option A, 62220. 62220 is for creation of shunt ventriculoatrial jugular auricular, and option B, 62223 is for creation of shunt ventriculoperitoneal pleural other terminus. Check option C, 62190. It is for creation of shunt subarachnoid subdural or atrial jugular auricular, and option D, 62192 is for creation of shunt subarachnoid subdural peritoneal pleural other terminus. Now let us read the question and highlight the important terms. The patient is a 73-year-old gentleman who has noted to have progressive gait instability over the past several months. MRI demonstrated a ventriculomegaly. It was recommended that the patient proceed forward with right frontal ventriculoperitoneal shunt placement with Codeman programmable valve. What is the correct code for this surgery? So here they have mentioned right frontal ventriculoperitoneal shunt placement. So which code matches with ventriculoperitoneal shunt placement? The correct code is 62223, that is creation of shunt ventriculoperitoneal. Therefore, the right answer is option B. Option A is wrong because it is for ventriculoatrial, but in the question they have given ventriculoperitoneal. Therefore, eliminate option A. And option C, 62190 is for creation of shunt subarachnoid, and also 62192 is for subarachnoid subdural peritoneal. But we have to code for ventriculoperitoneal. Therefore, all the other options are wrong. The right answer is option B. Next question. Let us check the codes first. 64704 is for neuroplasty, nerve of hand or foot. And option B, 64713 is for neuroplasty, brachial plexus, and 64721 is for neuroplasty and transposition, median nerve at carpal tunnel, and 64719 is for neuroplasty or transposition, ulnar nerve at wrist. In the question, they have given what is the CPT code for decompression of the median nerve found in the space in the wrist on the palmar side. So which among these four options is correct? The correct code is 64721. In the question, they have given decompression of the median nerve found in the space in the wrist on the palmar side. The code 64721 matches the question because it describes the procedure of decompression of the median nerve at the carpal tunnel, which is a specific space in the wrist on the palmar side. Therefore, the correct code is 64721. 64704 is wrong because it is for neuroplasty nerve of hand or foot, but it is not for the median nerve in the wrist. Therefore, eliminate option A. And option B, 64713 is for neuroplasty of brachial plexus. That is also wrong. Next, 64719 in option D is wrong because it is for ulnar nerve at wrist. But we have to code for median nerve. Therefore, the right answer is option C. Next question. This is the last question. Let us check the options first. Check option A, 67801. 67801 is for excision of Calasian multiple same lid, and option B, 67805 is for excision of Calasian multiple different lids, and option C, 67800 is for excision of Calasian single And option D 67808 is for excision of Calesian under general anesthesia or requiring hospitalization, single or multiple. Now let us read the question. A 2-year-old male has a Calesian on both upper and lower lid of the right eye. He was placed under general anesthesia. The Calesian was incised and a small curette was then used to retrieve any granulomatous material on both lids. What CPT code should be used for this procedure? So we already checked the 4 options. In the question they have mentioned Calesian on both upper and lower lid. The Calesian was incised and any granulomatous material was retrieved on both lids. And also they have given the patient was placed under general anesthesia. So which code is matching? The correct code is 67808 because it is for excision of Calesian under general anesthesia or requiring hospitalization, single or multiple. Therefore, it is matching with the question. The right answer is option D. We'll eliminate option A because it is for excision of Calesian multiple same lid and also the code does not mention general anesthesia. We have to code for excision of Calesian general anesthesia for both lids. Okay. Therefore, option A is wrong and option B is also wrong because it is for excision of Calesian multiple different lids. But we have to code for excision of Calesian under general anesthesia. Option C 67800 is wrong because it is for excision of Calesian single. So that is also not matching with the question. So that's it for today. Thanks for watching. I will see you in the next video with more important questions and important topics related to medical coding and CPC exam.